today. Good morning.
Good morning.
Every single time I say it like that, I get mad at myself. I hate how I do that. But I'm in the mood for just absolute chaos this morning.
I've never heard somebody say you're in the mood for chaos.
I'm in the mood for chaos. Listen.
You just want to stir the pot.
I don't know that I want it. Chaos and drama, not the same, right? I don't want drama. I want chaos. I want just like, my energy today is just like maybe up to here. You know,
just, you're feeling feisty.
Feisty. And you know what else? A little on the ornery side. I haven't. At what point in your life do you quit getting called ornery and start getting called like maybe something less kind? Like kids are ornery. What are adults? At what point are you no longer ornery? That's a good question.
And just like a B?
Just kind of a hard B. Because, like, ornery is, like, it's not mean-spirited. It's just kind of like, ooh, she's a little ornery. At what point, or sometimes maybe it is.
Good question.
At what point are you no longer ornery and you're just kind of a dick?
You know what I want to know?
What?
Is at what point do kids feel like when they're eating, like that they have food all over their face and care about it?
That's a good question. I'll let you know when I figure it out.
When, because it's not 4.
It's
not 4 yet.
It was Easter weekend. Obviously, you were there, you know. And I look at my 3.5-year-old, and like, there's a true thing where like you get mom blind and mom deaf, to where the mom, you just kind of quit hearing it, and then just like the constant ring of dirt on their face. Mm-hmm. You just kind of start to ignore it. Like, that used to bother me. I used to be very, like, my kid used to be clean. Yeah. And now I've gotten mom blind where I'm just like, oh my gosh, is it dirt? Is it pudding? Is it something else?
Who knows?
I'll worry about it at bath time tonight.
Yeah. Like, because it's like, well, what's the point of even having the fuss of wiping it?
And then
you know it's like...
Yes.
Yeah. So I just let it sit there. Just go hose it off.
Mom blind, mom deaf, and it's again, it's true. It's the mom. Hey mom.
Brian, hi. I changed my TikTok handle to Medicare, all because of you. If we were friends on LinkedIn, I would have tagged you.
Don't give him too much credit.
I didn't know what else to change, but I do hashtag Medicare.
I love that
on everything now.
Well, just so you guys know, welcome to the Medicare Cafe, where
it's 10.
Me and Carrie haven't seen each other in weeks, right? Probably a month.
I've been pretty ill.
Yeah, and now you have, that was another thing we talked about, you have a potential ear infection, and as an adult, being so ill, you have an ear infection.
Yeah. That's what I kept asking my husband, because I was like, can an adult get one?
Oh, I'm sure. Like, you get, like, an adult can get swimmer's ear and stuff.
Oh.
It just so happens that the side that I'm sitting on, is no longer her good ear.
It is not.
Ironic? I don't know.
And I keep, when you get water in your ear and you, like, do this, you jump on one leg and hit your head. I keep doing that because I'm like, it feels like something needs to, like,
hold on,
come out.
You do what? You jump on one leg?
Right now. Yeah, you, like, hop.
No. You lost me at hopping on one leg. Do you sacrifice a crow?
When you have water in your ear.
I don't jump on one leg. I do the Roxbury vibes.
Well, if you jump on one leg, it helps it come out.
Does it?
Yes.
Okay.
But not when it's not water. But it feels like it's water, so I keep doing that.
If you see Carrie on the street just hopping, just leave her alone. Mind your own business. Welcome to the Medicare Cafe. Today we're actually talking about something.
Feisty. That's what it's
feisty. I'm telling you, I am the chaotic energy, and I'm not gonna apologize.
I love this topic.
This was actually your idea.
It was. I just remembered.
It was. It was
my idea.
Today we're talking about the pre-appointment, and exactly what you need for a good pre-appointment. Why is that? This exact reason here. Are you adding value to your appointment? Are you adding value to streamline the appointment? Are you adding value to your client? Or are you wasting time and creating busy work for yourself?
Totally adding value.
Well, okay, I think yes. If done correctly. I don't know how you could do an appointment I'm an efficiency, I love efficiency. You have to have some information prior to the appointment in order for you to be efficient and to keep your appointment from being 2 hours long.
So I think one of the biggest time wasters of a pre-appointment is they have so many questions. And when they're like, well, I just want to know, should I do an Advantage plan or should I go with a supplement? Yeah. Don't go through that with the pre-appointment.
Same brain. So this is let's get into it. I have
don't do your presentation before in the pre-appointment.
I have
that is wasting
broken
time.
up being what should you ask in the pre-appointment and don't waste your time on.
Okay.
And we're on the same
Always
page.
on the same page.
And I love when that happens.
I never
what
look
a
at the
great
sides.
day I'm having. Okay. So, what is helpful to know? So, this is what I put as far as what questions or what information should you get prior to the appointment. The doctors that they're seeing, the medications that they're taking, because you need that information for if they go on Medicare Advantage or PDP. You need that information regardless. Any health conditions, any major health concerns that they have, Part A and B effectives, and what they're currently on.
I have 2 other big ones.
Let's hear it. Spill the tea.
My first is I always ask, are you already drawing Social Security?
That's a good one.
Because if they're already drawing it, I know that we don't have to talk about applying for A and B. So I always ask that, and if they say, yes, I'm already drawing Social Security, then I ask, well, have you already gotten your card? Bring that with you. And then the other one I ask about is retiree plans, especially here. Mm-hmm. If they're I usually ask, are you retired? Where did you work? And if they say university, well, do you qualify for the MU plan? Because that could be completely wasting my time.
Right. Okay.
So if they're I worked at the university for 35 years. I'm like, well, that university plan is going to be the best plan for you. We can meet, but I'm just going to tell you that one's, so I may have just saved myself an appointment.
Yeah. Yeah. Is there any value for those university plans? Because I know there's a bunch of them, the Boeing ones. There's a bunch of them that especially if you're a local agent,
oh yeah,
what those are. But is there any value to being looking at their annuities, looking at their cancer insurance, looking at hospital indemnity? I know it's not their, it's not their core stuff, but for a plan like that, is there value in being well, let's kind of do a full portfolio review, knowing that your major medical is going to stay there.
You could still totally do ancillary.
Yeah.
It would depend on the retiree plan.
Makes sense. Okay, so
Brian's on it. Brian's feeling feisty today,
when
too.
I tell my friend what my friend said, I tell him the friends are dumb. Brian, I don't know how you're successful doing this. So the only one that I was hesitant to put on here was health conditions. I think it's really helpful to know their health conditions at the beginning of the appointment. Mm-hmm. However, 2 reasons why I shy away from that, and I want your input. Mm-hmm. One is because sometimes certain health conditions, people, whenever they don't know you, they never met with you, they may be kind of anxious to tell you about their health. They may I don't really trust you yet to tell you about my health conditions or my concerns.
Yep.
And then 2, fact-finding is a crucial part to an appointment, not the pre-appointment, but the fact-finding is a crucial part for cross-selling and is a crucial part for the relationship building. So I like the idea of asking those questions to kind of let you know, either this is going to be, I need to do a bit of research before this, or oh yeah, we're going to have a walk in the park. You're going to be able to do whatever you want to do, right?
I don't, in my pre-appointment, that's not one I ask about, but I feel anytime somebody has a big condition, it's they can't wait to tell you. It's the first thing that they say. Yeah. Because they're worried about it.
Oh my gosh, what a great point.
So I have diabetes.
I missed you.
I have diabetes. I need to make sure I have good drug coverage. Yeah. Or I have Parkinson's and I take tons of brand name drugs. Mm-hmm. So I feel
you don't have to ask that in the pre-appointment.
Yes, because they come out and just say it because that's what their biggest fear is. Yeah. Because they do have a condition or they just got diagnosed with cancer.
What a great point.
So the health conditions one, isn't one that I necessarily ask in the pre-appointment. But still, it can't hurt to ask that.
Yeah. Somebody on here asked, no one can figure out what to do with the GEHAs, or retiree gov type plans. Which I don't know what a GEHA is.
Oh, GEHA, that's...
GEHA!
That's how I call it.
It's insurance for cowboys.
I think I've only seen that once. They have a huge headquarters over in Kansas City, I think.
Yeah, and then somebody said health conditions, so I can tell if they qualify for a sneeze plan. Yeah, I can absolutely. Again, my thing is, it's just kind of your style. For me,
yes,
I would probably wait for health conditions until the actual appointment. Just because, again, I use health conditions as a way of like cross-selling and things like that too.
For sure.
I don't know what GIA is,
Wait,
but I'm forever saying it.
Retiree plans are hard. There is a...
Oh, and if you want to text me, that's my number. She would probably know. It says text. That number. You know what to do.
Yeah, so I should have compared this. So I have so my assistant does a lot of my scheduling for me.
Mm-hmm.
And so at that point, I have a list of things to tell Jaden. I'm like, make sure you get this, this, and this. And I always ask about retiree plans. I feel like that's a huge one because what is time wasting is if they are eligible for a retiree plan and they don't bring those plan documents with you.
So like bring it.
You can't do anything.
Yeah.
Like, because you can't compare premiums and deductibles and any of that.
Because like they don't know, and you can't
Right.
you can't make you can't advise them on which one's a better option for them.
Something for drugs too. I bring up drugs in the pre-appointment, but I usually don't take them over the phone because people butcher the names.
Yeah.
And I'm like, bring your drug list with you to the appointment.
Okay, that makes a lot of sense.
But sometimes I'll say if you take like more than 10, email it to me beforehand.
If you had Retireflow, you would have that ahead of time. So we'll get into that.
Yes.
But just something to keep in mind.
Educate me.
I will. I love Retireflow. So that is what we're saying you should do, or the information you should have. Adding carries retirement options, if not, in conjunction with current plan that you're on.
Mm-hmm.
Don't waste your time with, there are two big ones here. Don't waste, and it's kind of what you and I just talked about.
Yes.
Don't waste your time with asking them what do they already know about Medicare or answering a ton of Medicare questions.
Yes.
And don't waste your time with, what was my other one? Don't waste your time with trying to diagnose them if they're interested in a Medicare supplement or a Medicare Advantage plan. The number one reason for that is that you need to do, those things need to be covered in your appointment process. Sure. We recommend an 8-step selling appointment. I know your agency recommends like a 7 or 8-step selling process. The biggest thing,
it's 8.
Is it 8? Yeah, they're a little different, but the biggest thing for that is that your appointment process needs to be the exact same every time. The outcome may look a little bit different, but you need to have your process down pat, and that is including your fact finding and including your education portion of your appointment. Because, I mean, we all know it. We'll have clients that come in, to your point, Brian, believe it or not, I'm going to reference you, a good point you made, is that, well, my brother's, sister's, cousin's, dog walker's aunt uses this plan. That's exactly what I want. They have no idea. Right. They have no idea what the plan is actually right for them. So even though they come in saying, I'm here to buy a Medicare supplement, you still need to educate them on their options, because chances are they're just really misinformed. Even if they end up going that route, they still need to know all the information to be able to say, like, and to keep your retention. So if somebody comes in and talks about Medicare Advantage, they don't say, my agent didn't tell me about that, or, vice versa.
Yeah, I always say that's a great plan. That is one of the ones that I'm going to show you, but I'm going to show you everything that you're entitled to.
Exactly. Brad, good morning, Brad. Retiree coverage, as well as currently working and have coverage, but now qualify for Medicare. How much are they paying for work coverage versus Medicare cost?
Yeah.
And it's not only cost. Costs aren't the only thing that's important when it comes to this information. Obviously, it's really easy to be like, exactly. It's easy to be like, well, you have this much of an out-of-pocket on your work coverage. You have, this is your deductible here. You don't have any of that on this Medicare Advantage or this Medicare supplement plan. So if you're only looking at cost, you may be missing some big factors, including things like the providers. I have seen it where, like, I was actually, we had one of my team members was asking me about, like, why would they stay on COBRA versus going to a Medicare Advantage plan? Well, I've seen it to where COBRA covers certain medications way better. So it is worth them to stay on COBRA for an extra 18 months.
For sure.
So there are a lot of questions. It's not always, oh, you qualify for Medicare, that's the one to get on. The biggest one that I see get overlooked is the spouse.
I was just going to say dependents, or a lot of people still have kids. That are on the plan.
People under the age of 26 or like dependent children. Sorry, go ahead.
Yeah. No, it's just that was the thing I was thinking of saying, was that you gotta watch for the dependents too.
Yeah.
So, I've had multiple instances where it was cheaper for them to switch to Medicare, but their child or spouse would have been SOL, so they
so they stayed on it.
They stayed on it.
Makes sense.
I'm lost here.
Brad said, I love it. He said, Brian must be a Royals fan. Brian is a Royals fan. He's in the Kansas City area, so let's make fun of him.
Let's make fun.
So yeah, again, never skip any step of your appointment process because somebody comes in and says, I want a Med Sup, I want a Medicare Advantage. They don't know what they don't know. Making sure that you are going through the process every time.
I have so many people that are like, I don't even want to talk about an Advantage. I know I don't want it. And I said, okay, well, I'm going to tell you about it because you're going to have questions about it.
Set them straight.
Listen here.
Listen, Karen. All right. This is what I want to talk about. Again, busy versus
cough.
The audacity. You coughed once during an episode, Carrie. The audacity.
Like 10 times
I
already.
haven't noticed.
Good.
Busy versus productive. Again, this is my biggest point. Down at the bottom one, I'm going to skip a couple. Don't try to jam pack. Don't jack it. Too much. Nope. Don't jam pack too much in your pre-appointment process to where it takes away from the fact finding. Because I am a huge believer that the relationship is built and that the cross-selling happens in that pre. So why don't you do this? Because you say that you have a 2-appointment process, and we've talked about this several times, but it really works for you.
Yep.
How do you do it? So tell me your appointment process from like your prospect, your referral to I'm turning in an application.
And it's not always okay. Yeah, let me just start from the beginning. So usually, so many of mine are referrals from a financial advisor. So they have given them my card and they call me, or I'm connected by email. And so when I call this referral back, I'm doing my pre-appointment with them. I set up the meeting. We have our educational meeting. And then from there, it's probably 25% it's a one and done then. But the other 75%, my financial advisors know I like to meet with them early because I want to be the first one they see.
Absolutely.
And so a lot of time they don't have their cards yet. So usually at that meeting, I'm telling them how to apply for their A and B, or and we're obviously going over what other plans they'll get. And then my second appointment is, sometimes it's just their signing, or the second
you're doing
appointment.
Like e-apps and sending it to them, right? Like a lot of times you're not meeting with them again.
Sometimes it's physically in person. They want to sign in person. But the majority of the time, no, it's a phone appointment. I'm gathering their card information, and then it's all e-apps.
Very cool.
So it's not really... It's not always a second appointment. The second appointment is usually just a phone call to do a signing.
Okay. Yeah. That makes a ton of sense. I can certainly get behind that. So just making sure, again, that it is working with your process. Just don't try to jam too much in the pre-appointment because the conversation is what really kind of tends to build that. But you do want to know, like Carrie mentioned earlier, to know like what do they need to bring for the appointment. Now, I'm going to talk about it because I already mentioned it once. But I really like Retireflow and of course using MedCenter. My biggest thing is making sure that you are using technology to not replace relationship, but to replace process. Okay. And so what Retireflow is one of them. Retireflow does all the pre-appointment process in a link. And so you text or email your clients a link. You can do it in bulk or you can do it one-off. It has your logo, your name, your headshot, everything about you, and it collects collects, if it's a prospect, it collects permission to contact, but it collects a scope of appointment, drug information, and it's like the same one that you use on Medicare.gov, where like you start putting in the name of the medicine and it auto-populates, lets you know if it does everything that like a Medicare center does, but just before the appointment. A and B effective date, current coverage, any type of conditions, everything. And then you have that information prior to the appointment.
Have a lot of your agents been using it?
We have a good list of agents that have used it and seeing a lot of success with it. Yeah, really enjoying it. It is CMS approved and it is HIPAA compliant and HIPAA safe.
That's awesome.
So they came out last September. Really excited to work with them. If you use Senior Marketing Specialist, you put SMS 40, you get like a significant discount on it. Okay. So just keeping that in mind. But again, big fan of them. They
it's genius.
It literally does the entire appointment process for you. Pre-appointment process for you.
Because part of the other thing is like with drugs, unless they like so many times people forget them.
Mm-hmm.
So, like, if they are entering them in at home, they're
right
less
there.
likely to forget one.
And it's not like their handwriting that you're having to read. It's right there. And again, it does like the whole like you're typing it in and it pre-populates does the most likely prescribed. So like it kind of helps them and streamlines the process for them versus them having to remember to bring in that list.
That's really nice.
So highly recommend it. Big fans of theirs, big fans of what they're doing. But that middle point right there, have a backup plan for that exact reason. They forget to bring, or they, you're unable to get a hold of them. You're, whatever the case may be, maybe they didn't bring in the things that you wanted. Making sure that your process doesn't live and die by your pre-appointment. You got to be able to bob and weave and do all the things.
One other thing that I always do in my pre-appointment is I write down one little snippet of personal information that they say that I always bring up at our meeting to try to like just be mindful or to show I like paid attention. Like I just called somebody this morning who was like, "Oh, sorry, I'm watching my granddaughter. I missed your call, blah blah blah." I'm like, "Okay, so they watch their granddaughter."
Yeah.
So I'll talk about I could talk about kids forever.
Yeah.
I'll talk about that at our meeting. So I feel like also making sure you are doing some of that warm up.
Yeah, that's a great point. Excellent opportunity for warm up.
Yes. Or at least jotting down points for your meeting to really strengthen that warm up.
Do you ask questions or is it only like if they voluntarily give you that information?
I don't really ask too much unless it's about, if I'm asking about a retiree plan, I'll go into like, I like hearing what people do. Like I'll ask, well, what did you do or whatever. But I don't really ask too many warm-up questions on the pre-appointment.
You're just kind of like, what can?
I just listen to like little hints that they could have said.
I still remember how allergic I am to your cat. We've all been there. We've all been there. Well, like, it's like if you're at your door, like, oh, like, what's a piece of information about you that I remember? Still allergic to your cat. We've all, again, the door-to-door stuff, I always talk about the fur cookies. Whenever I used to do, it was something that has been ingrained on me. When I did door-to-door politicking, I would always, the little old ladies I would do senior housing and they wanted somebody to talk to. So even if I need you to sign a petition. You either give me money or sign this petition. And she'd be like, come in and tell me about it. And you would have the fur-covered cookies. That's always where
fur-covered cookies.
So yeah, that is what we wanted to talk about.
I told you I had a cockroach appointment, right?
You did not.
It stuck with me. I mean, I will never forget it because I hardly door knocked. The only time I door knocked when I first started was with Tim.
Okay.
Just to like get some experience.
Yeah, cut your teeth.
And we were in a house and I remember Tim like elbowed me in the appointment and like pointed down and there was a cockroach crawling into my bag. And
I just got the chills.
And the lady was like sitting in a little love seat chair and she leaned forward to get something and like cockroaches like crawled up the seat behind her. And you know what? This is why you always have to ask about income. They were subject to Irma.
So they made so much money
that they could not afford to move out of that trailer with cockroaches.
Isn't that that's what, like, I was telling you that, again, Bobby always talked about when he was going door to door, was in this person's house, dirt floor, just like, of course, he was telling the story because her disabled son attacked him, but that's a whole nother thing. Dirt floor. And she went out and he was trying to sell her insurance and ended up like an annuity thing. And she goes to her mattress and just gives him like handfuls of cash. And you're just like, I never would have guessed that they would have bought this, been eligible. You just never know. You never know what's important to them, right?
The cockroach house was making good money.
Oh, that's unfortunate. I'm upset.
Yeah.
In the meantime, I did have a couple questions I wanted to answer. So one of the first ones is COBRA credible coverage. COBRA is considered credible coverage for Medicare Part D, as in dog, for your drugs. It is not considered credible for Medicare Part B, as in boy. No. So a lot of people will end up delaying Medicare Part B because they want to extend their COBRA. And then whenever they go to enroll in Part B, they'll oftentimes either have a penalty or they don't have an election period to enroll in Part B. So they have to wait until the general enrollment period, January 1st through March 31st. So it is not for B, it is for D.
I had somebody, I may have asked you about this. I had somebody who was trying to push the limits of that. And they were like, well, if you don't get
I remember this.
a penalty for 12 months, can't I push my COBRA out 11 months? And I was like, I don't know. I guess you can. I've never had somebody try to push those limits. I can't guarantee you won't face one, but
yeah, I don't know why. And again, like, there are reasons to stay on COBRA, even though it's going to be hugely expensive
I don't
for
even
them.
remember why.
The biggest time I've seen it happen was because of the medications.
I think it was a spouse. I think they were trying to keep their spouse. I don't know. It was weird though.
And then another question: do you actually help them apply for A and B if they need it?
I mean, we're not supposed to, but I have.
Yeah.
I have.
Yeah. So, like,
I have probably 10 times in the last, 5 years. So not a ton.
Not a ton.
I just give them instructions. I usually email them instructions of how to do it, and they do it.
And they do it. Yeah. That makes sense.
But I've had, probably 8 of those 10 were farmers who were, don't have smartphones, don't have computers, don't have emails.
Yeah. So it's like on
and I'm like, okay, just let me help you out.
Let me help you. Yeah, we can do this. Awesome. Great. Well, if you
guys
guys
know why we're not supposed to?
I don't know. I know there's a lot of reasons of I know a lot of the reasons on why we're not supposed to do things that are Medicare, as in Medicare Advantage, PDP. For example, if you don't sell Medicare or prescription drug plans, you're not allowed to help somebody on Medicare.gov. You're not allowed to run drug lists. You're not allowed to do any of that. So I can go through all the reasons there, but as far as why you can't help them apply for A and B, I have no idea.
Yeah.
So, but if you have any more questions, again, that is my line. If you are watching the recorded version of this, you can text this at any time. This is my number. You can text it at any time. I'm here to respond. Or, of course, you can always join Brian and Brad
on the chat.
Which, you guys are, kind of neighbors, too. You guys live at, or work in the same area. You guys should become friends. Look at us making friends. Okay. So, anyways. That's all I have. Anything else? Any other last words of wisdom that you would like to leave me with, my friend?
I think so.
Okay. I got another one. Is COBRA ever considered credible? And I think I answered that. If I didn't answer that, text me and I'll shoot you a text back and forth.
COBRA gets confusing. Same thing with VA coverage. Because the VA, they're both credible for D, but not B.
It is. It's the weirdest thing. Now, there is a lot of NAFA. Not NABU. NABIP which is the National Association of, it's the benefits. What NAHU used to be.
Yeah.
So NABIP is actually doing a ton right now. Well, they're a little consumed by other things right now, but they're constantly working on getting COBRA considered credible for Part B. So that is something that they're working on, but they've been working on that for a few years now, and we have not seen much movement on it. But they've been a little busy with other things, like the final ruling and stuff. So more details.
Are we going to get an update on that?
Literally.
Or will they have one soon?
Any day now. They said 60 days from January 5th, and we're past that.
Yeah.
By a lot.
Yeah.
So we are waiting. So really, I'll say it like this. They have been publishing a ton of other rulings and other, not in Medicare, but in other realms. So I imagine we're going to see the final ruling on Medicare any day now.
Hoping so.
Fingers crossed. We'll see. And just, again, final ruling, had a conversation about this. Final ruling doesn't always mean the final. It's just, again, this is
not to confuse anybody.
What carriers are going to do, things like that. More information to come. So even when we get this ruling, doesn't really answer.
The final rule is not final.
It doesn't really answer any of the questions that any of us are going to have. So more to come. So
it's just called the rule.
It's just the rules.
It should be the rule.
Mm-hmm. It's just the ruling. All right. So any other questions, comments, concerns, sets, or promises, throw me a text. But until next time, guys.
Have fun.
Make money.
And give impeccable service. Did we just switch?
We did, and we did it without missing a beat.
Wow.
Nailed it. Bye.